on this episode of A Tale of Two Hygienists.
If we talk about the prevalence of periodontitis and we say, okay, there's 65 million American adults with periodontitis between 30 and 79 years old, and there are currently approximately 6,500 practicing periodontists in the United States, we can work until our fingers are raw, and we're not going to be able to treat all of those periodontitis patients. And so we know that who's treating those periodontitis patients, who's making hygiene diagnosis for those periodontitis patients, who's talking to those patients about what their home care should be, how frequently they should be coming back in, are our dental hygiene colleagues. Hygienists can become that whole health practitioner, that wellness promoter in their practice. And to do that, you really have to understand the oral systemic connection. This is important for us to know and for us to be able to deliver high-level care to our patients.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, into this bonus episode brought to you in partnership with our friends over at TheraBreath. We have one of the most interesting, one of the most dynamic periodontists in the world on this episode today, and Dr. Mia Geisinger. We caught up with her at RDH Under One Roof, and we talk about, lots of different things, but I think where I loved the conversation where it went was that we talked about how integral the dental hygienist role is in patient health. I think a lot of times, when we're talking to the doctors, we focus on their participation, and then we talk about our participation. And in this episode, we really talk about the combination. We talk about what that partnership looks like. How do you have the conversations with the periodontist? And she gives her expert advice on things that patients should be doing at home, which I think, coming from someone who is as researched as she is, really helps us to kind of see what that full circle of care looks like, whether they're seeing the periodontist for specialized treatment, then they're seeing us, and then what they're doing for the home care, and then coming back to our offices again. It's really good advice. And then in this episode, she mentions TheraBreath. And I want to be clear, I'm not a spokesman for TheraBreath, but they are sponsoring this episode. But I've also been using it since RDH Under One Roof. I got several different samples. I've really been enjoying it. It's a different feel, everyone. And I think that we kind of get a little bit jaded sometimes. We're like, oh, a mouth rinse is a mouth rinse is a mouth rinse. And it's not really. And I think it's incumbent upon us that we need to try out everything. We need to know what we're giving to our patients. We need to know what that feels like. And so I would really encourage you, if you want to try a sample for yourself, all you have to do is go to oralcarepro.com/TheraBreath. You don't need a promo code. You don't need an affiliate link. Just go straight to the source, oralcarepro.com/TheraBreath. I'll also put that in the show notes so you can just click through if you want. And I think that's it for me for this intro. Thank you so much to TheraBreath. Thank you so much, Dr. Mia Geisinger, for being a participant on this. And thanks to Erica Flateau for helping me interview. All right, enjoy the episode.
A tale of two hygienists.
All right, listeners, welcome into the podcast. We're very excited to be joined by Dr. Mia Geisinger. Thank you very much for being here.
I'm so excited to be here. Thank you guys so much for having me.
My gosh, you are one of the number one people that are requested to be on the show. And I should have you on a lot more, actually. You're so busy. You do so many things all the time. And I'm just like, I don't want to burden you.
We're just two people hanging out, talking nerdy. Like, why wouldn't you want to have me on? Come on.
See, that's the appeal. That's what people love about you, is like you, okay, so you're a periodontist, but you're so approachable.
Oh, that's nice.
You do such a good job. Listeners, look, I understand not all of you have this perfect relationship like I have with Doctor. However, if you don't mind, just give me a brief introduction of who you are to our audience.
So I am, my day job is that I am a professor, acting chair, and director of advanced education in periodontology at the University of Alabama at Birmingham. I'm a periodontist, been a periodontist for 20 years. And I also am currently the president-elect of the American Academy of Periodontology. So I get to come to places like RDH Under One Roof and speak about perio, interact with my dental hygiene colleagues, my dental colleagues. So this is a great opportunity.
Can you give me a little bit more about like what drove you into kind of like specializing in perio versus all the other options you had at your fingertips?
Oh my gosh, such a great question. So, when I was in college, I actually worked as a dental assistant and I worked in an oral surgery practice, and I loved the surgical aspect of it. But essentially, most of the patients that we saw were there for prescription surgeries. They were there to get their thirds out. They were there to get an implant placed, and we saw them, initial exam, surgical treatment, a couple of post-ops, and then they were done. And when I went to dental school, I decided, I really wanted to look at some of the other surgical specialties, but in particular periodontology, because I really liked the idea of having a long-term relationship with my patients. And so I feel like for me and for my personality, it was the best of both worlds. I know this is going to come as a shock to you, Andrew, but I'm a little bit of a nerd, little tiny, little nerdy. And so I loved like the evidence-based aspect of it. I love the science of it. And I really enjoyed getting to have those relationships with my patients where we maintain people over a long period of time. I've been at UAB now 17 years. I have patients who have been with me the whole time I've been there. And I can tell you, their story front, back, and sideways. So it's a lot of fun.
All right. I got a off-script question for you, because this is something that drives me crazy about nerds and research people, because I'm not that person. How do you find good research, credible places that you are going to hang your hat on without any quibbling?
So it's such a great question. Being at a university really helps me, but I have actually kind of gotten in the habit of listening to podcasts that are associated with certain journals.
What a great plug, by the way, for listening to podcasts. Thank you very much. Keep going. Great. Yes.
So for example, like for me as a periodontist, the Journal of Periodontology and Clinical Applications in Periodontics both have podcasts, and they'll feature, a deep dive into particular articles. They also do kind of summary articles where they'll ask someone who's not associated with the research to write a little blurb about the research, and then they feature it on their social media pages. So I follow some of the journals that I like the best on social media, and I listen to podcasts about them. And that's a great kind of starting point that's really accessible. If you're, in the operatory and you don't have access to PubMed where you can, search and figure out, is this a good article or is this, kind of garbage?
The first time you and I met, it's been several years now. I believe it was like an AAP meeting or something like that. You, of course, are sitting in the front row. It might have been the second row, but I'm pretty sure it's the front row.
Well, that's where nerds sit,
center.
Andrew.
I know. Do you guys know about the T of success? Okay, the T of success is the front row. That's the top T. And then down the middle aisle. Like, those are the smartest people. Anyways, that's T of success. So you're on the T of success, and I sat behind you, and I noticed that sitting next to you wasn't a bunch of dentists and doctors and all that. It was hygienists. Where did that relationship come from, where you obviously have a huge respect for hygienists. It's very evident in just getting to know you. But where did that come from?
Well, I want to say, first of all, that as a periodontist, I know, and I think my periodontal colleagues know, that, dental hygienists are really the periodontal practitioners in every dental office. If we talk about the prevalence of periodontitis and we say, okay, there's 65 million American adults with periodontitis between 30 and 79 years old, and there are currently approximately 6,500 practicing periodontists in the United States. Well, I'm mathing that in my head, and I'm thinking we can work until our fingers are raw, and we're not going to be able to treat all of those periodontitis patients. And so we know that who's treating those periodontitis patients, who's making hygiene diagnosis for those periodontitis patients, who's talking to those patients about what their home care should be, how frequently they should be coming back in, are our dental hygiene colleagues. And so if we're not in the business of elevating those colleagues and having a great relationship with them, I think we're missing out. And so for me, that has always been foundational to my practice. I think a sharp hygienist keeps you sharp. Our hygienists keep us on our toes. I know they don't let me get out of line at all. So, from my standpoint, it has been critical to have a great relationship with the hygienist in our practice, but also the hygiene community as a whole.
Do you mind going through like what is that day-to-day interaction with the hygienist go like for you? Because I think we can pretend like we know what happens, but in the ideal situation, what would you have?
Oh, wow. In my practice or
in
okay.
practice.
So in my practice, we work with periodontal hygienists. And what I mean by that is when I do surgery, I have a hygienist who's in there who assists me. And then in many cases, once I've elevated flaps, he or she will actually perform the debridement during the surgical care.
Nice.
And this is so educational. As a periodontist, I'd like to believe that I deliver very good non-surgical therapy. But I know when I elevate those flaps, there's still accretions on the root surface. And, that's because we're dealing with patients who have advanced disease and deep periodontal pockets. And, from my standpoint, having the hygienist see that makes them better when they're delivering non-surgical therapy as well. So I get a lot of information about our maintenance patients from the hygienist. And because they've seen the surgery, they have a lot of knowledge and information about the history of that patient that they can take and use for their ongoing maintenance care. That's been critically important to our success in our wellness practice, which is what we call our maintenance practice.
And what a great visualization for the hygienist.
Exactly,
we would all just love to be able to see
I
that.
invite any hygienist in the community to come when they refer a patient from their practice. I was like, do you want to come for the surgery? You see
Might be a little
what it
humbling,
looks
though.
like? I mean, for me too.
Fascinating.
Listen, I do non-surgical therapy. For me too, it's humbling, but we're all there. And it has to be a safe space where we're not blaming anybody. This is why advanced care sometimes is necessary.
And what do you say to the hygienist? How do you encourage the hygienist in a general practice that is struggling to find time to do a thorough perio chart with all the recession and all the bleeding points and total attachment loss and the time to try to do the staging and grading and learn about it? And I'm seeing a lot of variance when I see different hygienists stage and grade. So how do we reach them and lift them up, and what resources should they look to?
So I know that I believe it's coming out fairly soon, but there is an article that I wrote for DACE that's going to talk about staging and grading. And I'm really excited about that. But I would also say that something that we found in our practice about 8 years ago, we moved to this wellness model. And part of the wellness model was empowering our hygienists. And they make the decision about how long they need to deliver non-surgical therapy, to have their maintenance appointment. I don't say, okay, it's going to be 60 minutes for every appointment, whatever. They tell me. And what we found is that, yes, they see less patients in a day. We move from 8 patients to 6 patients, but production is steady or increasing. And it's because they have the opportunity to talk to their patients about everything they need. They have the opportunity to do the exam that they need, to do the radiographs that they need, and to talk to patients, let's say, about fluoride or local delivery of antimicrobials. And we also found that about 30% of the patients that we see end up getting diagnosed with some other type of need, whether it's caries or an endodontic lesion, and they get referred out. Well, in a general dentist practice, that's going to be referred out to be performed, on the restorative side. For me, I refer it to a colleague.
But for them, yeah, it's like it's a driver of practice, a driver of business.
Absolutely, 100%.
Do you feel like the hygienists from what you've encountered from the general practice, that they're a little bit more timid than maybe a perio? Like the way I look at it is like a hygienist working in a perio practice is the top of the top. Like I'm so in awe about what they do, and then here I am slumming it in the general practice. You know what I mean? Like, do you feel like they are a little bit more intimidated in the general practice, or do you feel like there's equality there?
I don't know if they're intimidated, but I know they shouldn't be intimidated, because in my opinion, it's a way more important job, because there's almost no backstop, right? for our hygienists, if they feel like they have a question about the diagnosis or come take a look at this, there's a periodontist there who can come in and say, okay, this is what I think. In the general dental office, though, many times, the general dentist is really relying on the hygienist's expertise to help guide their treatment planning. And so it's even more important that they are empowered and that they have the education and the knowledge to really be able to do that, because in many ways, the buck's going to stop with them.
Yeah, the general dentist hygienist is having a lot of the hard conversations and informing the person they even have the disease. And so by the time they get to you, maybe they understand that. Are you finding that to be the case?
Well, the number one chief complaint when a patient comes to a periodontist office was, I was told I had gum disease. And there's actual scientific paper data backing that up. But one of the initiatives that I'm really excited about with the American Academy of Periodontology is our hygiene engagement initiative and our hygiene recognition program, looking at connecting periodontists with dental hygienists through periodontal study clubs, through the AAP, and, really giving them their community periodontists as a resource to be able to go to when they do have to say, okay, well, how do I have this difficult conversation? This patient had been coming in every 6 months, and now I'm noticing disease. How do I manage that for the patient? And, a really important thing to think about is, okay, well, if I go to my physician last year and then this year I go and my triglycerides are elevated,
right?
I don't think she feels bad to tell me my triglycerides are elevated. She says, what are we going to do about it?
Right. Exactly. It's just so black and white. This is what it is. What are we going to do?
Yeah.
Right.
I have a question that I'm sure, sick and tired of answering. It's about the referral process. When do we refer?
So I'm not one of those people that think that anybody owns any kind of procedure or management. What I will say, though, is that there are clinical standards that we need to be treating patients to. And we need to treat patients to clinical endpoints. So if we have done our non-surgical therapy and we still have deep probing depths and we still have bleeding, the solution can't be, okay, we put this patient on a compromised maintenance. There needs to be another level of care. And for those patients, in many cases, referral for specialized care is really that next step. Today in our talk here at RDH Under One Roof, Katrina Sanders, the dental hygienist, a little shout out for her, and I were talking about a study that was done looking at dental therapy, periodontal therapy for the impact on hemoglobin A1C in patients. And they looked at patients who got supragingival scaling and then patients who got intensive therapy. And that intensive therapy was treatment to endpoint, treatment to no sites in the mouth that were 4 millimeters and bled. And what they found was with just the supragingival therapy, hemoglobin A1C actually went up. Systemic inflammation went up. But when they did the intensive therapy, when they treated to an endpoint, when they controlled oral inflammation, A1C went down. So it's not just about oral inflammation, right? We are in the wellness business. That's why I say our hygiene department is our wellness department, because we are in the wellness business. We are treating the whole patient. And what we do is really important for their oral health and their overall health.
And how do you feel about recare? Alternate or keep it in the perio office? Or
in most cases, I like to alternate. I want the patient to continue to see their treating general dentist, their restorative doc. There are some cases that are really those refractory grade C patients that have had a lot of disease progression where I'm either going 3 perio, 1 general dental, or I'm saying, look, we're going to keep this in our practice because I'm so afraid of what the disease progression could look like if we're not really tight on this management. But I promise you, we're going to send you the radiographs, and if there's caries or if there's other restorative needs, we will return this patient back to you.
Very nice.
But for most cases, we're alternating with our general dental colleagues.
Awesome.
I want to pivot to home care a little bit because it seems like that some hygienists are really good about communicating, having some sort of influence with their patients. And then other hygienists and doctors as well, but I want to focus on the hygienists if we can, are maybe less successful. Do you have, tips and tricks about like how can we be more influential and what kind of influence do we have with our patients?
So I mentioned I was a faculty member, a professor at a dental school, and one of the interesting things in the pedagogical literature, the teaching literature, is that if you ask someone to do a self-assessment before you grade them, they're more likely to take constructive criticism. So for all of my home care instructions, I start with, if you had to grade yourself for brushing and flossing, what grade would you give you? Everyone gives themselves an A for brushing. Almost no one gives themselves an A for flossing. As well, they should not.
Yeah.
And so that gives you an opening to say, okay, I think you're an A student. How can we get you to an A? And then we talk about interdental cleaning. We talk about what are the adjuncts we can use. What are the potential, dentifrices, toothpaste that we should be recommending? What are the other things that we should be recommending based upon their specific needs?
And can you discuss some specific products that we can recommend?
Well, first of all, I'd like to say that every patient we tell brush and floss better is going to brush and floss better.
Hey.
But I think all of us know that that is not the case.
Absolutely true. Absolutely.
And so if just by saying brush and floss better, if we're having patients come in and they have suboptimal oral hygiene, we have to think about providing them the tools to get better. And we have lots of tools in our armamentarium. We know that powered toothbrushes are much better than manual toothbrushes. And if patients have suboptimal oral hygiene, moving them from a manual toothbrush to a powered toothbrush is going to get our bleeding points down over a 6-month period. The data on that are very, very clear. If we look at flossing, yes, flossing is a method of interdental cleaning, but it is not the only method, nor is it the best method. If they can get an interdental brush in between those teeth, that's what I recommend that they're using. Only 4 to 8% of U.S. adults floss daily. So most of them are in this hall.
I was going to say exactly.
Yeah, everyone that we know is in that group, right?
Yeah.
So, if they're not using it, it doesn't matter what we're recommending. So we talk about, interdental cleaners, whether that's a powered flosser. I love an interdental brush, and I try to fit the interdental brushes for the spaces. But, that's our baseline. Brushing 2 minutes twice a day, interdental cleaning, and then we get to layer on our other options. So we get to talk about, for patients who have gingival inflammation, are you using a stannous fluoride toothpaste rather than a sodium fluoride toothpaste? Because stannous has anti-gingivitis properties. Are there opportunities to use a mouth rinse as an adjunct? And what are the particular types of conditions that we're looking at that this patient has where we can make specific recommendations for that patient?
And when you discuss layering, you're saying start with the basics, get them brushing twice a day with a power brush, and then moving on from there, not overwhelming them?
Yes.
Okay.
Yes. And I think it's important, too, to think about how we're instructing our patients about home care. Are we just telling them to do it? Are we showing them how to do it? Are we having them do it and watch them and coaching them up? And, there's a lot of opportunity out there with the new technologies in oral home care where, some of these new toothbrushes are fancier than my first car. They got the internal GPS where it says, how long did you brush in every quadrant? And
you get a text that says you haven't brushed.
Yeah, it's pretty neat. So, they're on it with some of these new technologies. And, that kind of feedback for the patient, plus motivational interviewing and really taking the time to have those conversations with the patients makes a huge difference.
Kind of along those same lines, though. It's like, I feel like, one, mouth rinses don't get enough love. Like, we even just barely touched on that, and then we talked about some other stuff, and then we came back on it. But two, that has also changed. It's not a one-size-fits-all, right? When we're growing up, it was like, whatever burns my mouth the most is what we're going to use.
There was actually a commercial that talked about that,
Isn't
right?
that crazy? And so that's what you use. You're like, okay, this is mouth rinse. This is what it is. But now we know it differently. If you have a specific oral condition, there's a Give Me a Mouth rinse that's targeting that.
I mean, absolutely. So, for example, in the periodontist practice, but I think in all of our practices, because of polypharmacy and because our patients are getting older, we see a ton of xerostomia. Well, you have that mouthwash that burns, that has alcohol in it. That's not a great armamentarium for a patient who comes in with dry mouth. And so how do we target that patient? We want to look for something that has no alcohol in it and that really has some products in addition that are beneficial for patients who have dry mouth in particular.
I recently tried one of the TheraBreath lozenges and the flavor was awesome. I don't really suffer from dry mouth, but I wanted to see how it tasted. And it was pretty good.
It's interesting because, I've seen a big spike in dry mouth in my practice because of the new weight loss medications, the GLP-1s and the GIPs, and xerostomia is a known side effect of those medications. So now when a patient comes in and they say they're taking semaglutide or they're on Mounjaro or whatever, Ozempic, I'm going to say to them, I think maybe we should consider switching some of your products to alcohol-free and to something like the TheraBreath for dry mouth that has lysozyme and amylase and amyloglucidase in it, that's not just generically alcohol-free, but actually has these enzymes in it that are meant to work more like a patient's natural saliva, to, play an important role in immunity and antibacterial, antifungal, to digest carbohydrates. And I think that's so important to really think about how are we targeting these patients and making a difference and delivering real patient-centered care, personalized care, instead of just a one-size-fits-all stamp and here you go out the door with your goodie bag, right?
And is there a time period after rinsing where you feel some relief?
So, I think that if we look at the dry mouth rinse, they can use it and then supplement with those lozenges that you have said are delicious and, use that throughout the day. So much better than, I'm taking a mint. And that now we're worried about caries in a patient who's xerostomic.
Or a cough drop or a sour gummy or something.
Oh my gosh, right?
Well, unfortunately, doctor, we're really running out of time. And I want to just do one quick, just kind of sum up of the thing. The thing I like about TheraBreath is just that they're very supportive of this kind of conversation. We've touched on the topic. Folks, if you want to learn more, I have links in the show notes. Make sure you go back there. There's all sorts of different formulas for you to look at. But what they're really supporting, though, is this conversation between a periodontist and the hygienist and the hygiene community. But doctor, for you, though, it's all about education. What are the topics, real quickly, that you think the hygienists need to really deep dive into?
I mean, I think for me, thinking about how hygienists can become that whole health practitioner, that wellness promoter in their practice. And to do that, you really have to understand the oral systemic connection. And I say oral systemic, but, as a periodontist, I think periosystemic. If we talk about 57 known systemic illnesses and conditions that are associated with periodontitis, this is important for us to know and for us to be able to deliver high-level care to our patients. And then the other thing I would say is, start thinking about what are the ways that you can enhance the diagnostics and the delivery of care using technology, using new and exciting products that are out on the market, and really think about how you can elevate your care so that you are delivering patient-centered, personalized care for every single patient. And that takes empowerment of the hygienist. It takes education of the hygienist and also the dentist. And it takes communication. And I hope that the periodontist and the AAP can be a partner in that. And I'm really appreciative of just having the time to kind of, like I said, talk nerdy, but also talk about these things that sometimes we don't talk about and the stuff that is hard that goes on in the dental office and in the hygiene chair.
Man, we definitely don't have enough time to cover every single topic that you're so knowledgeable on. But if people wanted to follow you, if they wanted to find you and find more resources, where can they find you?
So I'm on Instagram. It's at Mia G, DDS, MIA G, DDS. Or my hashtag is periodoc and heels. You can go to my website, which is miageisinger.com. But, I would love to hear from any of your listeners, and always fun to sit and chat and talk dental.
Thank you very much, Doctor.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.